Thank you very much for being here. This session is one of 3 of the breakout sessions, as you all know. So you get to come to this one, and then we'll shut it down at 1:45 or thereabouts, and then meander over to another one, and then you get another one after that. So this is option number 4, and of course we'll talk about lung cancer, public awareness, and getting the word out. I'm Wayne Tuckson. I have the pleasure of being the moderator for this session, and what we're going to try to do is we're going to discuss methods to increase awareness of lung cancer risk factors and the benefits of screening and early detection in rural and under-resourced communities. An added benefit is to reduce the stigma associated with lung cancer. That's the interesting thing that kept coming up, the stigma about lung cancer. You know, most other diseases, you get colon cancer, nobody looks at you. But you get lung cancer, people say, you did something wrong. But so we're going to try to deal with that and find hope in innovative treatments and therapies. Our panelists are, I'm going to start on the end because we got brother Dr. Earl Benjamin Robinson. Mm-hmm. If you want to be correct, you got to say Nupius. But we're going to just say Dr. Benjamin Robinson for us today. But can we call you Earl? Is that all right? You don't mind if we all use first names, do you? Good, because I don't want to, And then may or may not join us, Dr. Ezema. You remember from yesterday, but Brother King tells me he may or may not be able to make it. Then we have Stephen King. Here's my immediate left. I forgot to tell you, but Dr. Benjamin Robinson is from the Bach group. And so we're going to find out a little bit about what that is and what kinds of activity they do before we get into the formal thing. And then we're going to have Mr. Stephen King, who is a public health leader and former statewide strategist for Louisiana Department of Health and Case Management for St. Vincent de Paul of Baton Rouge. Mm-hmm. And then we have, how do you say it right, man? Baton Rouge, how do you say it? Baton Rouge?
Oh, Baton Rouge.
Baton Rouge, all right. Yeah, then we have... And then also to my right here, we have Mr. Eric Wenzetto, who's the Director of Advocacy, American Lung Association, Louisville, also up there at Baton Rouge. Thanks for making the trip down here. So what are we going to do today? We're going to have about a couple of 5 minutes or a little shorter introductory remarks by each one of our guests, our panelists rather. And then after that, we're going to open it up for a little bit of discussion. Now, if you take a little longer, that's fine. If you take a little less, that's fine too. So let us start off there with... Earl, why don't you lead us off, man?
Cool. Good, I was about to say good morning. Good afternoon. I am Earl Nupius Benjamin Robinson, a 20-plus year public health practitioner.
Thank you.
I am a board-certified public health practitioner, and I am a distinguished fellow with the National Academy of Practice in the Public Health Academy.
Cool.
I own a boutique public health firm called the Bach Group. Bach stands for Behavior and Community Health Group. And so I've been owning that business for about 15 years. Our office is out in New Orleans East, next to the New Orleans East Hospital. But I recently left a position at the Louisiana Cancer Research Center. I was the inaugural director of the Office of Community Outreach and Engagement and the senior director at their program, the Louisiana Campaign for Tobacco-Free Living. And so I've been working in public health a long time. And before I turn it over, I think one of the most important things that we don't do enough of inside community health and could be a value add to the cancer work that we do is we don't spend enough time being in relationship with community. Mm-hmm. We just go to community oftentimes just providing them a lot of information. But I would say that relationship and building up trust is sometimes even more important than the information that we provide to people. Because if you don't have that trust, if you don't have authentic relationship with people, the information that you have and that you're sharing is not important.
Earl, before we go away from you said something I think that was very interesting. Mm-hmm. And so what should the relationship be between the community and the public health departments?
So much like you, I have my spouse that I have a relationship with. Mm-hmm. I have my friends that I have a relationship with, my parents that I have a relationship with, and I just don't go to them when there's an issue. I'm having a conversation with them continuously throughout life, checking in on them, sharing information with them. And so for me, it's about, to answer your question directly, the health department should be in the community consistently. And I think one of the ways that we can help to operationalize it, and we're seeing it in some areas, is I think health departments need to be spending more resources around creating community health worker positions,
Yeah.
and making certain that those individuals are really trained in helping to bring information to communities. These individuals are primed to share some of the most important information and some of the most important resources that people are likely going to listen to because they look like the community, they're from the community,
Gotcha.
and so they're more, and they have relationship with community. So I think, one of the ways that we can be in relationship with community is by hiring community health workers, people from inside the community who may not necessarily have college degrees, but they have relationship with community, and they know the issues that exist inside the community, and they know who needs to know messages inside the community.
Gotcha.
So I would say community health workers.
Thank you very much. Go ahead, Steve.
All right. Good afternoon, everyone. My name is Stephen King, and I am a public health practitioner, outreach specialist, case manager, supervisor, minister, award-winning gospel rap artist, as well as I'm a previous
Award-winning.
Yeah.
Is it?
award-winning
Now, who gave you the award?
recording artist.
We got the King Award here, man. I mean, award-winning. But go ahead. I'm sorry.
Sorry, my bad. I previously served as the statewide health disparity strategy manager with the Louisiana Department of Health, Office of Public Health, Bureau of Community Preparedness. I also, early in my career, I worked as a data analysis for the Louisiana Breast and Cervical Health Program, which it operates under the largest program within LCP, which is Louisiana Cancer Prevention and control programs. We also serve over more than 5,000 low-income women each year, receiving no-cost cancer screening and patient navigation as well. So I bring over 12 years of experience within public health, as well as disease reduction, community engagement, as well as cross-sector partnerships. My focus point is providing evidence-based solutions for different programs. I think you have to have data, but also making sure that you, just like he said, partner with the community and making sure that you're adjusting accordingly, but making sure that you're in the community. But we partnered with the LDH. We created spaces where we provide mobile health screening units to different communities, and partner with barbershops, faith-based organizations, community-based organizations, in order to get the word out and making sure that people are aware of the services that's provided. Because Louisiana. How many of y'all from live in Louisiana or from Louisiana? If y'all know that Louisiana is 49th and 50th in health outcomes, and in order to tackle that issue, it's meeting people where they are, and that's so essential. Is to partner with trusted partners, internal and external partnership.
Thank you very much for that. The winner of the first annual King Award. Go ahead, Eric.
Good afternoon, everybody. My name is Eric Weinzettel. Very happy to be on this panel with my distinguished colleagues, and I do not have quite the titles list off, but I'm happy to be here. No, I'm a lifelong Louisiana native. I am a licensed master social worker focusing on macro policy. I come from a family of teachers and social workers. I saw my mom doing micro work, and I said, man, that looks tough. So I decided to go the macro route and try to make change on a larger scale. After I got my master's degree, I came back to Louisiana, came back to home, and I started looking for policy jobs, and that's where I started with the Louisiana Department of Health as a tobacco policy analyst. I had a lot of goals going into it and wasn't quite sure what kind of policy I wanted to do, but I found tobacco, and of course there's that inexorable link from tobacco to lung cancer, and that's where I found my job where I am now. There are a lot of great things to working at the state, a lot of great resources being in the room where it happens, but one of the most frustrating things I saw was you are forced into neutrality over policies and bills that you see coming through. So it's very hard to see these policies being passed at the legislature and being asked to write informational statements on them, but not being able to call out for how terrible they truly were. So it always kind of ate at me over the years. And so whenever this position opened up to be the director of advocacy for the American Lung Association, I jumped at the opportunity. I loved my colleagues at the Bureau of Chronic Disease Prevention and Healthcare Access, but the ability to advocate for lung health and to combat lung disease in our state was something I truly have grown to love. So I had my background in tobacco, but I've been learning more and being more involved in our clean air work and our lung cancer work. In addition to what I do in advocacy, which is I am constantly at the Capitol, monitoring for bills, making comments when possible, working with great volunteers, trying to cultivate storytellers in the community, because one of the things you see is that you can have a legislator who's perhaps a bad actor or is just ignorant, and they can argue the facts with you all day and they can deny what they want, but the one thing they can never deny is your story. And so what matters to them is whenever you have someone who's been impacted by lung cancer and you tell them your story, that is the avenue really to make a change. And so what I'm trying to do and what we're trying to do is get the word out, to cultivate storytellers, to try to get advocacy actions taken. And I'm really happy to be here.
That's interesting. I want to go back to you, and then we're going to go back down this way. From what we heard at the lunch session and at the session before that, I mean, when we had the community people speaking, there's a certain absurdity, if you will, in which we tell the story, the legislator knows the story, but yet nothing is done. And I think nothing is more frustrating or unnerving than where it's 1,200 feet from the fence line, I believe was spoken several times. So how do we get to that legislator? And then we're going to come back. And what do you tell the person who lives across the street from these facilities to keep fighting? How do you, I mean, at what point do you say, come on, man, are you kidding me? How do you do that?
I think that's when, you know, just like there's a show of it. So before I got into advocacy, I kind of had an idealized version of what I thought the lawmaking process was, that there were these rules and decorum and everybody gavelled in and everything. But it's a lot more dreary. It's a lot more down in the dirt. But there is a lot of showboating. So there's the two kinds of advocacy. So there's the advocacy when the cameras are on, whenever you're doing your testimony in committees, where we make our statements. And then there's where we get the phone calls, the emails, whenever if they do come into their communities, talking to them off the record. That's when you're real. That's when you tell them be as real as possible. And it's hard, but consistency is key. And then using whatever tactics we can to put pressures at all levels, because it's the legislator, but as they were talking about, it's the Department of Environmental Quality, it's the EPA. All of these things are the confluence, and you have to put pressure at each level so that when and if the opportunity for change does arrive, whenever we have established ourselves to make our voices heard, that's when your advocacy really takes the next step forward.
Thank you. So, Stephen, same question, but I want you to, with all the different hats that you have worn, how do you approach it to individuals? And again, because of what you're doing, you know, in St. Vincent de Paul Parish, how do you enforce the power to pay attention and make that? We heard, you know, there's two different, there's when the lights are on, when the lights are off. Right. But sometimes where the lights are on, lights are off, we're still getting screwed.
I believe it's essential to partner with elected officials, not just elected officials, but just like he mentioned, the community health workers, the health educators, the social workers, and things in that regard. But in regard for the policy making, actually inviting the elected officials to events like health fairs, different things like that, and like pinpoint. Like for us, for the Louisiana Department of Health, we use the social vulnerability index data to help pinpoint areas of in different parishes with rural, like disproportionate areas. So from there, we created health fairs, but we invited the mayors, we invited the senator, we invited the governor and different individuals in order to so they can see like the lack of access to healthcare and different barriers like lack of transportation, but meeting people where they at, just like I mentioned before. Partnering with different agencies, external partnerships, in order to, bring in like mobile health, mobile screening units and things in that regard. But we partner with Mary Bird and different agencies in order to collaborate and meet people where they at. But even like the pastors in different parishes, we allowed them to partner with the policymakers to also give testimonials. It's so important to give testimonials so like people can go to church and say, hey, sister so-and-so, come up and talk about your testimonial of you overcoming and the process you went through, so people can be aware, individuals can be aware of that, but policymakers actually come into church and being involved as well.
Go ahead, Earl. You want to chime in, or you want me to put something else to you?
Before I chime in, I want to thank Eric because oftentimes when we think about social workers, we think about social workers only being in the child care system and taking children. And I like when I see social workers in policy director positions because they have a full understanding of what's happening inside an environment that is contributing to this thing. So I just really want to take the time to applaud you for the work that you're doing.
Does that mean you're going to give him one of these King Awards? Okay. All right, go ahead.
Eric, you have a King Award.
You got it.
So to answer the question, I think what's important to me, at the Bach Group, we believe and are centered in empowering some of the most vulnerable populations. Because at the end of the day, Eric is a lobbyist, I believe. Can you lobby?
Yeah.
Okay, so he can lobby, which means he can go and tell the whole truth and nothing but the truth. Having worked inside nonprofits, having worked inside the federal government, state government, with certain nonprofits, we have to be careful.
Right.
Because our funding can be pulled, and so often, and we're not lobbyists, and so we can only be centered in what the best practices say. We can't even talk about if it has a specific build number, we won't be talking about that. We're only going to be talking about best practices. So for the people in this room who are working in the community, who are affected by cancer, who are living with cancer, our loved ones have died as a result of cancer, I want to, what I am centered in is building your capacity to know what to do. Because at the end of the day, I think Eric talked about this, and also Mr. King talked about this, getting people to tell their stories. I may not be able to, the last time I went and spoke at the legislature, I think you were there, there are only certain things that I can say. And so, and I can't, when I hear stuff that is like, that is so silly, and you want to say something, but you can't say anything. But you know who can say something? People in the community, people who have these illnesses, people whose spouses are wanting to come there and talk about their spouse not being there anymore, and they want to represent them. And so it's imperative for us to provide you the education, the information that you need to go and tell your story. Because at the end of the day, that is what most often will get people to change their minds, how you tell your story. And so some of the most vulnerable individuals inside our communities, they don't know that. Oftentimes when you talk to low income or poor individuals, people of color, people in the rural communities, they are not aware that they can be active participants in the policies that happen inside their local communities and inside their state. And so oftentimes what we do a lot of is education, and it's about educating communities. And so I think for me, it's about, particularly at the Bach Group, we're about making certain that some of the most vulnerable populations are empowered enough to know what it is that they can do and support them in getting that done.
Well, you've given me a wonderful segue, which I wanted to touch on, and we're going to start off this time with you, Stephen. And I want to look at, and I'm going to approach this from a negative standpoint. So what group is the hardest for you to reach when talking about lung cancer?
Interesting. Okay.
And tell me why they're hard.
All right. For me, just navigate when I work for the Louisiana Breast and Cervical Health Program and talking with different individuals, people that potentially maybe, have addiction to nicotine or smoking. That can be someone that may have a barrier and things in that regard, or they may have lack of self-efficacy to stop smoking, or go forward with making sure that they're covered. So that I would say that, and someone that has what is it, medical distrust, right? A lot of individuals have medical distrust, or in regard to they don't want to go to their provider or things like that because they feel as if that that person may not assist them, or they may have different things, mental health issues, or even just controversial thoughts or things like that, in order for them to have barriers. So I would say someone that is addicted to nicotine, or actually, making sure that or also making sure that they also just individuals that have different barriers such as that. So.
It's not the answer I'm looking for. I'm gonna come back to you. Eric, how are you gonna handle that?
All right, hold on, check off that one. No, I think I do think that's a good point. But another thing to consider, especially here in Louisiana, is access to resources. So there is the distrust of care that is completely true, and the fact that. And I'm just experiencing this with a friend of our family, how hard it is that when you actually do have access to medical treatment, how frustrating it is when you have a doctor or provider who doesn't listen to you or doesn't take you seriously, when you are taking time out of your day to find resources to drive to wherever it may be. Because a lot of people in our state don't have, we may have an urgent care or something, but we don't have fully staffed oncologists, pulmonologists. Like, you have to drive to our larger cities, and do we have public transit to get people anywhere? No, we don't. So I think that's one of the biggest barriers for certain, is one, reaching people to let them know that they should, like, that what they're seeing, what the symptom they're seeing is serious enough that they do need to take the extra hurdle to get there. And then how do we support that so then they can actually go seek care in a place that provides it?
Earl, give me the answer I'm looking for.
So when we look at who are the remaining smokers in the state, probably since 2019, we've seen a tremendous drop inside our state as it relates to the smokers. We've gone from 21% of Louisianans smoking, and we're all the way down to 14%, and it might even be lower this year because the data's, well, I don't know what's going on with CDC, because we may not have that.
We're not allowed to discuss that. We can't discuss CDC.
From last year, our smoking prevalence inside the state was at 14%, which is very, very good. When you tease that back, there are individuals who are still smokers at a disproportionate rate. There are African American males. There are LGBTQ individuals. People with 2 or more mental health issues. People who did not finish high school. And so it's some of the most vulnerable populations who, to answer your question, that are still affected by and are still smoking, and are disproportionately affected by those health conditions that are happening as a result of smoking. And so you can pick any one of those populations. It's hard to convince because those populations are dealing with social determinants. They're dealing with, I got to go to work, I got to feed these children, I got stuff to do, I'm in school, I have all these other things happening. And so sometimes health does not take a priority. And in fact, smoking kind of helps to lessen the stress, per se, of what's happening to them. And so I would say from any of those populations, but in particular, just if you were going to snowball it, a lot of low-income individuals inside the state, particularly African Americans, are some of the hardest to, not necessarily to convince, but because of, and Mr. King talked about this, because of distrust, inside the healthcare systems, but also because of I got other things to do that are take priority. I got to feed these children. It's just I don't have time to deal with this health issue. And I'll stop smoking at some point in the future. And so I think for me, to answer your question, it's those populations, but if I was going to put them in collaboratively in one group, it's a lot of low-income individuals who are not because they don't want to, because when we look at the data, about 71% of the people want to quit smoking, but it's just hard.
I think you guys have really covered it because it's not any one single demographic and it's not just one reason, but there are a multitude of reasons, be it from transportation, identification, trust, and then all this. All right, if you all have a question, feel free to raise your hand, but I'm gonna start off, unfortunately, you're sitting on the front row right there. I want you to give me the one word, who do you talk to about lung cancer?
Family members.
Okay.
Family members who were exposed to different toxins. Unfortunately, breast cancer runs in a family, and sometimes it can often go to the lungs. So then that becomes another conversation.
Right.
But
Okay.
usually family members, just dealing, we work alongside each other with the state and other nonprofits.
Oh, he didn't tell me he had a plant in here. Okay. Oh, I see.
We got a couple.
Okay.
people.
Go ahead, man.
In regards to, as a community advocate, the community, but also I think a good link is not only just for agencies to go in a community to talk about this information with community members, but also make the link to other agencies within that community so that they know that they can work collectively together.
Sounds good.
Developing education.
Okay, we heard. No, don't look away. You're in the brown jacket. I'm coming to you. I'm coming. I'm working my way around.
I was going this way.
No, yeah, fooled you. So,
Okay.
all right. So, talking to family. When do you talk to family?
I have a daughter who is a nurse practitioner.
She ain't here right now.
No.
So when do you talk to family now?
When I talk to family, I call her and I tell her, I say, this is going on or whatever.
Yeah.
And so she helps me to make those decisions.
Yeah.
And that's very helpful. But I wanted to add this too, when we were talking about why people are smoking. You guys named really great groups and all, but I always think about where New Orleans is. We
Right.
the French Quarter, okay? So people are employed at bars. Bars are jobs that are easily for low-income people to get, waitresses, waiters, whatever. And so if you pass that building or whatever, what you gonna see? They're outside taking a smoke.
Yeah.
And like you say, it's not that they want to do this,
Right.
no,
Right.
but that's their only way.
Yes.
Now, what I did find out, Oxford, and I'm quite sure Tulane and all the other major hospitals here, they have a trust foundation. I don't know if that's exactly what it's called, where they will have a patient come in, regardless of cause, and they can enroll in this program to stop smoking. And they will give them the medication. They will give them everything, and they don't, after they have that one visit or that phone call or whatever, how they do it, they don't have to worry about going back. They will send that medicine, like it's $300 and some worth of medicine, to the pharmacies, to their nearest pharmacy, to help them. But again, we have to say that this is when the patient has decided this is what they want to do.
Okay.
All
right.
She's
So,
talking about the smoking cessation.
Cessation.
yes, yes.
And I think
Yeah.
it might be coming to an end. I mean, I
Yes,
think
That makes
it
sense.
hasn't ended already.
Yeah, you had a question. Go ahead.
Did actually come to an end for new enrollments.
Yeah.
But the, working with the tobacco treatment specialist is still free.
Good.
It will always be free.
All right.
And so I think Chantix, they can still get, I do inpatient smoking cessation for Oxford. And so I refer all day, every day patients to the outpatient clinics. And Chantix, they can arrange.
Still get
I
Chantix.
don't know if that's through Oxford or a grant or what that's from, but they do get that free. But all the other medications, oftentimes with the doctor's prescription, even the over-the-counter meds will be covered. But the specialists in the clinics are very expert at finding out how they can get it covered, if they can get it covered, or at least finding reduced costs with medications.
Right.
The program is still free. A lot of people don't want to go to classes now. You can work one-on-one. You can do virtual visits.
That's cool.
Bending over backwards to make sure that it's accessible.
I'm going to know, are we reaching the right people? Okay, so since, madam, you are the youngest person in this room, this is not saying anybody else is old, but you're clearly the youngest person in the room. Are we reaching you?
Yes, it's resonating with me.
How and why?
I am over the health ministry at my church,
Mhm.
and so I do a lot of advocating in my congregation and my community. And this is a topic that we haven't yet discussed. So, but on a personal level, my father is a smoker, and every time I'm around him, every time he lights a cigarette, I'm telling him to stop smoking. So we go and get his CT done yearly, and he actually verbalized that he's ready to stop. And that's one thing that people need to realize: they're not gonna stop until they're ready to. Him being a man of a certain age, that's a
Careful.
habit that he picked up
Be very careful about that.
a long time ago. And people in that generation, they just don't do what they want to do. You know what I'm saying? And so he's also a truck driver. And that helps with his nerves, and that's another community of people that's kind of forgotten about.
Yes.
So that's my goal, to kind of, advocate for them and teach them and reach them. And so you're definitely reaching me.
Okay, well, this is interesting. I love the things that we've heard so far. So, is there a difference between rural and urban in Louisiana? And I want to go broader with that. Are the issues that are faced by the rural and urban communities throughout the country, are there any different? 'Cause is everybody here from Louisiana? No. Brother McDonald and I know are not. So what about it? What's the difference here? Let's start off with you, Earl.
So there might be some access differences because many of the cessation services that are available in the Baton Rouge area, in the New Orleans area, they're here. You can go to LSU and get counseling in person. I think they might even have tele services. You can call 1-800-QUIT-NOW, which is available to everyone inside the state. But for those individuals who may want to see someone in person, individuals in the rural settings don't have ready access to someone in their respective regions. However, they do have 1-800-QUIT-NOW, where they can get counseling over the phone, and they can get, as a result of 1-800-QUIT-NOW, they can also get cessation services. Nicotine replacement therapies. I think 2 weeks of nicotine replacement therapy. But to just more directly answer your questions, it's access is one of the issues that makes it different inside rural versus metropolitan areas. I think also it's about just awareness. Like in the bigger cities, we have signs all of the times. We might even be having more conversations about tobacco use. We find that tobacco use is clustered in more rural locations, and so people who smoke, they may not be talking to each other about the dangers of smoking. Now everyone is aware of it, but when you have someone saying, hey, you shouldn't smoke, or your doctor is trying to get you to stop smoking, or you're seeing commercials, those are all little interventions that can push you in a certain direction. And I think people inside the metropolitan areas, they have more access to those interventions versus the rural individuals.
Eric, you mentioned about travel, and I thought that was interesting, but we heard an interesting thing about different types of jobs that are out there. So how does that impact the thing about when we talk about lung cancer? So person working in a bar, you mentioned. Somebody's working, your person's in a bar smoking.
Right.
Okay, and or the person who's working, a truck driver, or someone who's working in a factory. How does that rural-urban thing play out?
Yeah, I think it's one of those things that kind of transcends both rural and urban. Certain jobs that are more available. You see that in restaurants and bars, in casinos, everything like that. So it's the difference there is kind of really not what they can do differently, because it's kind of just it's almost something that's kind of been ingrained. And it's one of the things that we look about, especially in the mental health field. I know I'm kind of taking a turn to the left here, but the idea of kind of like harm reduction, and it's become kind of so accepted and kind of so accepted into our society. The idea of like, I've had a hard shift at the bar. I've just like this guy was just talking my ear off all night, was such a jerk. I need to go outside and smoke. That's part of the issue, is combating that thing that's so ingrained in our society that it has just become so normalized. Whenever, tobacco use is the number one preventable cause of death in the world, in the U.S., in our state. And so the fact that we've made a lot of great strides, but it's still that. And so I guess the question becomes, if this thing is both in rural and urban, what are we doing for these communities that are different? So we know we have the access to care in urban, and we know that we've made more progress in passing smoke-free ordinances. So in New Orleans, we have a smoke-free ordinance in bars. So, they're smoking outside as opposed to smoking inside the bar where workers are being exposed, but we don't have that same protection, as well as we don't have that same outreach and access to care in our rural communities.
So Stephen, tell me, same thing. How are you seeing the issue?
For me, living in Louisiana for 12 years, I'm originally from Michigan, Battle Creek, Michigan, but living in Louisiana for 10, 12 years or so, you see, there's a huge difference between rural and urban. However, like going into for instance, down here, downtown, uptown, like the Ward, Ninth Ward, and Metairie, Kennard, you see that there's a lot of hospitals, right? A lot of hospitals, there's a lot of different services here. But if you go to like Darlingsonville or somewhere like that, the medical, different medical services is not as available, and you have to meet people where they're at, and it's essential. However, you might have to, in the rural area, you have to meet them a little bit more. Like, again, I go back to the mobile screening unit and actually having health fairs in different places where you might see a Walmart in Louisiana. You just drive, you might see a Walmart, and then you might see like a small clinic, and then different things. But for me, it's just identifying the population needs, right? We did survey designs, like having survey designs, talking to the people, seeing what their needs are, and customize their needs as well. It's important. Just like he mentioned about actually talking to people that live in the community, and seeing where they're at and communicate effectively. I think it's important. Like, advocacy is so essential.
All right, we're gonna close this up, but I want a 30-second elevator pitch. So you're on the elevator, you're on the 14th floor, you're going down to the lobby level, and you're gonna have to give me. Earl, yours is gonna be on why should I worry about getting screened for lung cancer? Stephen, your thing is why should I even bother to get screened, because you're going to die from the disease anyway. And then Eric, I just want you to tell me, why should I be worried about, or should I be concerned about being a smoker? Only got 30 seconds now.
I do have one thing.
You go ahead.
But
You're going to do it anyway. Go ahead now. No.
one thing that I have noticed is that people who do stop smoking sometimes do eventually get cancer anyway.
Yeah.
And people have a mindset of, well, it happened to them, so why should I quit?
Why are you doing that? I was going to get on these guys about that. Thank you. Thank you. No, but that's exactly right. That is 100%, because this is what you hear. They say, well, not only, of course, we know that many things that can cause, well, I'm not going to step on these guys, but you're 100% correct. And I wanted that to see whether or not they were going to say that, because I was, thank you very much. No, that was great. No, you said two very important things, so thank you. You're going to take my spot next, okay? Go ahead. We're almost finished. Yeah, go away.
So since this is a summit that is largely focused on African Americans, and it's important that they understand that screening is prevention. What a lot of African Americans may not know is that we don't necessarily get cancers at the same rates as our counterparts, but we die at a higher rate than our counterparts who get cancer more than us. And so that's why screening is important. And so if one is a smoker, if one is located near an industrial plant, or if one has other other social or economic factors that contribute to the likelihood of them developing cancer, that individual should get screened.
All right, we're in the lobby. We're in the lobby. You had
Because
it, man. That's it.
screening can help to prevent you, you can identify
We're
that
in the
cancer
lobby.
is there.
That's it.
And so you
You've
can do
done it,
something
man.
about
Either
it.
you got me convinced. I'm telling you, man.
30 seconds
No,
is
that was a long time, man. That was more than 30 seconds.
It is.
No, go ahead.
Just piggyback what he said in regard to screening. It's essential to understand about prevention. So some individuals feel like, okay, well, I'm gonna die anyway. Let me keep smoking. However, emphasizing on individuals, not just needs, but their loved ones. A lot of people have loved ones. They have people that care for them, and making sure that, hey, you're not just living for yourself. You're living for other people, and that can increase self-efficacy for them to not just stop smoking, but also getting the services that they need.
Okay, you're at the bottom. Thank you. Aaron.
I would say if I'm in an elevator with someone, I would say, oh, you're still smoking. Well, listen, I could talk to you all day about how it's going to increase your risk of stroke, increase your risk of lung cancer, shorten your life, all of these negative aspects. But I just wanted to let you know that I don't judge you. Tobacco industry has been targeting people in Louisiana and the world intentionally. You are not the first and you won't be the last. And if you do decide you want to quit and you need help and need some resources, I can get you connected.
I just want to quickly summarize and say I think that I appreciate the comments from you all and from everybody here. This is a very serious problem. It is something that is not completely preventable, but we sure can decrease the mortality rate from lung cancer from some of the things. And the question is, we have to meet people where they are and work with them there. But the question is, are we using the right words? Are we using the right tone? Are we providing the right resources? And that's where we're going. But with that, though, thank you all very much for being with us, and we'll see you for the next one.